This is part 4 and hopefully the last part of the skeletal system, the second part of the skeletal system. And we are going to finish up with discussing joints and movement at the joints. Um, I don't think I'm not sure if it recorded or not, but abduction of the arm or the leg is whenever the arm or the leg moves away from the body. Adduction, I always think of it as you're adding that limb back to the body. So as you move the arm back to the body or the leg back to the body, it's adduction. You can also spread your fingers, and that's abduction. And then adduction is when you close your fingers together. Circumduction means that you use your arm to draw a circle. And you can do that at the shoulder and the hip joint. You can actually draw a circle on the floor with your foot. In fact, I recommend for you to try all these different movements because it'll help you to remember them. Now, rotation means like shaking your head no. That's rotation. Rotation at the shoulder joint is twisting the shoulder. It's not drawing a circle with your arm, but it's actually twisting your shoulder inward and outward. That's rotation at the shoulder joint. Pronation is whenever your palm is was facing front and now it's facing back. So if you're in the anatomical position and you turn to where your palm is actually facing your back or posteriorly, that movement is pronation. And then when you move it back from pronation back to the anatomical position, that is supination. Inversion of the foot, twist the foot inward. It's like your weight is on the side of your foot and the inward part of your foot is up. So it's an awkward move, but you can do it. Eversion is when you do the opposite. It's when you put the weight of your foot on the inside part of your foot and the outside part of your foot is, or the lateral part of your foot is up. Dorsiflexion and plantar flexion. Flexion is in both terms. Okay, so plantar flexion is when you stand on your tiptoes. Dorsiflexion is when you stand on your heel, on the heel of your foot. Okay. Opposition and reposition is a movement of the thumb. So when you take the thumb and touch one of your other fingers, that's opposition. And when you put it back, not touching any of your other fingers, is reposition. Elevation and depression you can do with your jaw, you can do with your shoulders. When you elevate your mouth is closed. When you depress your jaw, your mouth is open. And when you shrug your shoulders, that's elevation. And when you put your shoulders just normal, that's depression. Lateral flexion is whenever you do side bends, like you're standing in anatomical position and you just bend at the waist. That's lateral flexion. We already talked about some of these, but plane or gliding synovial joints have a slight movement. Hinge joints are like the elbow joint and the knee joint. The joints between the tibia and the femur, that's the knee joint. The ulna and the humerus, which is the elbow joint. The tibia and the talus is a hinge joint as well. And the joints between the phalanges. These are all hinge joints, and they permit flexion and extension. Saddle joints are when the two bones have a concave face on one side and convex on the other, kind of like a saddle. The carpal metacarpal joint of the thumb. So what does that mean? That means at the thumb where the where the metacarpal bone that connects to the thumb digit, where that metacarpal is connected to the wrist bones. That is a saddle joint. It's kind of hard to describe. In fact, if I can find the hand again, it's worth looking at. Okay, here we go. So it would be between, it would be here and here. Okay, that would be a saddle joint. And let's see, pivot joints permit only rotation. The atlas and the axis joint are pivot joints. The ulna and the radius joint is a pivot joint. The atlas and the axis, it allows you to shake your head no. That joint allows you to shake your head no. Condylar joints or ellipsoidal joints permit movement in two planes. It allows a bending at the joint or side to side movement. Like the radius to the carpals. I think we saw this. I think there was a picture and I didn't really go over it that much. When you abduct and then adduct your wrist, that is an example of a condylar joint or ellipsoidal joint. The ball and socket joints are your shoulder and your knee. Your shoulder and your hip. The joints of the humerus and the ulna. Together with the that should be the humerus and the scapula that form the shoulder joint, and then the coxal bone and the femur form the hip joint. Let's see, between the intervertebral disc, that is a symphysis joint. Remember, it's a cartilaginous joint, similar as like the pubic symphysis. Not cartilaginous, I'm sorry, it's fibrocartilage. And this shows you what happens when a person has a, no, it doesn't show you, but I can explain it, a herniated disc or a slit disc. All right, so this inner part right here, if it ever bursts through the outer fibrocartilage layer, that's a herniated disc. A slit disc is just when this outside part bulges. But a herniated disc is when the inner gelatinous layer called the, I think it's called the nucleus, but when that part bursts through the fibrocartilage outer layer. Okay, let's look at some specific joints. The shoulder joint. What we have at the shoulder joint is the head of the humerus. Now you can see some of the things that I've been talking about. The head of the humerus articulates with the glenoid. I'm trying to see where it's labeled. It's not, I don't think. Okay, well, it's where the head of the humerus articulates with the glenoid cavity of the scapula, which is not labeled, but it's right here. And then the coracoid process, you can see now where that comes, where that meets up with the head of the humerus, and the acromion, which meets up with the head of the humerus and also with the acromial end of the clavicle. So the shoulder joint has the greatest range of motion of any joint, but it's also most frequently dislocated, and it's an example of stability is being sacrificed for mobility. It's a ball and socket joint. And you can have bursitis in your shoulder joint. Another thing that's important, an important part of the shoulder joint, are a set of muscles called the rotator cuff muscles. The elbow joint consists of two parts. There's a joint between the humerus and the ulna, and a weak joint between the humerus and the radius. So there's actually three bones involved. This is the concave part of the ulna that the head of the humerus articulates with. Let's see if there's anything else I want to point out. The trochlea, the olecranon, this is the point of the elbow that is formed by a projection from the ulna. That's the trochlea of the trochlea. You kind of have to see it's going this way and it's hard to see. This is just a cross section through the trochlea, but the capitulum would be the one that articulates over here. It would be on this side, articulates with the radius, and then the trochlea articulates with the ulna. Let's see. It's a hinge joint. It's very stable. The humerus and the ulna are shaped in a way so that they interlock. The hip joint is another ball and socket joint. The femur articulates with the acetabulum, which is a depression in the ilium. It's the acetabulum of the coxal bone, and it's actually the ilium bone of the coxal bone. It is, in comparison to the shoulder joint, it's extremely stable. But it doesn't have the range of motion that the shoulder joint has. And this just shows you some pictures of the hip joint. Let's see, I'll blow this one up, the picture at the bottom. The acetabulum, this is the portion of the ilium that articulates with the head of the femur, and that forms your hip joint. Okay, the knee joint is a hinge joint between the femur and the tibia, but it also includes the interaction of the patella. Primarily, it's the joint between the femur and the tibia, but the patella is a part of the knee joint also, of course. The menisci, the medial and lateral menisci, are fibrocartilage pads that actually stabilize the knee joint. And I do want to point out to you, because this is such a common injury, you may have heard of an ACL tear or a cruciate ligament injury. So these are the cruciate ligaments. What they do is they cross. This is the anterior cruciate ligament, and then the posterior crosses behind that. The anterior crosses in front of that posterior ligament. So they form a cross, which is where cruciate comes from. It's the PCL and the ACL ligaments, and they help to stabilize the knee. There are lots of ligaments at the knee joint. Here is another picture of the quadriceps tendon and the patellar ligament, and then the patella that is actually within both of those structures, because they're continuous with each other. The patellar ligament attaches the patella to the tibia, and it's a continuation of the quadriceps tendon. That's important. The cruciate ligaments I mentioned already, they attach the tibia to the femur and they form a cross. And I think we are at the end. Let's look at the questions real quick if we can. Would a tennis player or a jogger be more likely to develop inflammation of the subdeltoid bursa? Definitely a tennis player, because the deltoid is in the shoulder. Daphne falls on her hands with her elbows slightly flexed. After the fall, she can't move her left arm at the elbow. If a fracture exists, which bone is most likely broken? And that would be her. She falls on her hands with her elbows slightly flexed. She has probably broken her ulna. And then, why is a complete dislocation of the knee joint an infrequent event? And that is because it's so stable. There's so many ligaments and that help stabilize the knee joint.